When looking into doing a dental residency, there are a lot of programs to choose from. But how do you know which one is going to be right for you? Stay tuned as we talk to a program director who's going to share with you all the details about his program, his GPR program. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, surviving residency, and life as a new dentist. Be sure you guys are tapped into the channel here, subscribe down below, but also hit those notifications so that you know when new videos are being released. Also, this episode of Ask Dr. Darwin is being brought to you by Dr. Darwin On Demand. Dr. Darwin On Demand, the ultimate exclusive community for new dentists. New dentists, as in pre-dental students, current students, residents, new dentist grads, and also international dentists looking to get licensed here in the US. It's an awesome group, awesome community that share tips, strategies, like-minded. We have weekly Q&As and also monthly masterminds as well. For more details, check down below at thenewdentistcoach.com/on demand. thenewdentistcoach.com/on demand. And we'll see you in the network really, really soon. Looking forward to seeing you. So today we're joined with one of the country's residency program directors, GPR residency program directors, not on the East Coast, not down South, not in the Midwest, but he's straight West Coast on the West Side at UCLA. Today we're joined with Dr. Ryan Grier, and we're going to be spotlighting his program at UCLA Harbor. So we're excited to hear more about his program and hear some more in-depth details about the program as a resource for everyone that's watching and listening. So, Dr. Grier, nice to see you, man. How you doing?
I'm doing good. It's great to be here. Thank you for having me.
Yeah, man. Opportunity. I wish I had the opportunity being on that beach where you at right now, though.
You always gotta. It's the little things. You always gotta show appreciation for the little things.
Absolutely, man. So please introduce yourself. Tell us a little bit more about who you are for those that are meeting you for the first time.
So my name is Ryan Grier. I've got my DDS from Howard University College of Dentistry. I did Morehouse College for undergrad. I moved right after undergrad. I moved to California, to Los Angeles. I worked as a high school educator in the Watts community of South LA. Then I decided to go back to dental school. I have a cousin and a couple of family members who, strongly suggested that I go to Howard. I have an older cousin who actually finished Howard as well. Once I finished Howard, I moved back to LA and did my GPR residency at LAC plus USC Medical Center, to an LA County Department of Health Services residency at one of the level 1 trauma centers in Los Angeles County. While I was there, I worked pretty diligently and really hard, and I guess I kind of stood out to my program director. So he strongly suggested that I pursue the opportunity to be the program director at Harbor-UCLA Medical Center, which is the other level 1 trauma center in LA County Department of Health Services. The current program director at the time was starting the march towards retirement. And so I came over and I worked with her, Dr. Lynette Jackson, I worked with her as we covered not only Harbor-UCLA Medical Center's dental clinic, but also Martin Luther King Jr. Outpatient Center's dental clinic. And so over the span of a couple of years, she went ahead and retired, and I assumed the position of program director. And since I began, we've had a couple people retire because we had a periodontist that retired, and then we ended up bringing in a lot of other very, very special folks to help us out. We ended up, and I'm really proud of our ability to network and provide a place that can nurture learning and nurture the academic pursuits of a few specialists. So we have a periodontist, we have a pediatric dentist, we have two endodontists, we have relationships with we have a maxillofacial prosthodontist. We also have a relationship with another prosthodontist that's really, really heavy in implant research. And he provides a lot of opportunities for residents and an opportunity for residents to network once they get out.
Wow. You said a mouthful right there, man.
Now, I know
So
I kind of hit a couple of things.
yeah, that's good. That's good because these are the things that people want to know about the program. So it sounds like that you've got a great network of specialists that all contribute to the residents' development and getting a lot more experience. Let's dive deeper. Let's go deeper into a couple things about your program. How many residents do you take every year?
So we accept 4 residents per year, and we're all 4 slots are matched. So
Max slots.
the usual process is, you apply through the system, and I try to interview 20 to 30. And people look at me sideways every single time I say I want to interview 20 to 30 applicants just for 4 slots. But I we'll get into why I do that as well.
Okay.
Because one of my, well, we can go dive into it now. One of the strongest, or one of the strongest characteristics of our program, I think, actually is our number one strength, is our diversity. We serve a really, really diverse patient population that is composed majority of Black or African American patients, but also a large majority of Latinx patients, and as well as another other cultures and demographics that kind of make up the diverse culture of Los Angeles County, especially south of Los Angeles, the southern regions of Los Angeles County. So I think that's just one part of the diversity that makes us very strong. Another part of our diversity is our faculty and staff. There's a diversity in cultural backgrounds, racial, self-identified racial, ethnic background, training, diversity in clinical experience, and a great diversity in perspectives when it comes to not just dentistry as a profession and an industry, but also how they teach. And that's something that I'm always conversing with residents about, is the ability to learn people's different teaching styles. And as a trainee, when you're in dental school, you get a lot of different uh, teaching styles, but it's very structured. And so when you get into residency, I like to say residency bridges that gap between dental school and the private practice uh, part of dentistry as a career. And
Right.
so learning how to manage relationships and manage different patient personalities also is something that I kind of want residents to get out there and figure it out, because I think that's where a lot of the learning occurs as well. So yeah, so I think our number one strength in our program is our diversity.
Gotcha. Gotcha. Now, as far as a second year, is there a second year that's offered? Do many people do a second year at UCLA or come from other
So
places to do a
so
second year?
at Harbor-UCLA, there we don't offer a second year yet. That's something that we've actually been working on and talking about, and
Okay.
we're actually figuring some things out about that in order to provide that second year experience, because a lot of dental students and our residents, they're coming out and you're trying to figure out the hand skills for, or become more efficient with your hand skills and get a better understanding of where all of that
Right.
science applies.
Right.
Because in a GPR program, a lot of the principles you learned in physiology and anatomy and pathology and even in biochemistry and farm, all of those things kind of come to term when you're in a hospital setting, because you're communicating so much with your physician colleagues, and you're not just looking at the basic the things that are really basic to our I call us a specialty. When you're in the hospital system, you're more like just one of the specialties. And so there's the things that we do, but then when you're dealing with nephrology, there's the things that they do, and they have their own drugs and procedures that they have. And when you're dealing with cardiology, it's different. And so we're all kind of in these, I want to call them silos, but in a hospital setting, all of these silos have to connect. They
Right.
have to explain things to each other. They
Right.
have to communicate effectively with each other. And I think that's a great benefit of working within of getting a GPR program.
And quite honestly, it's really reality too, because even when you go into private practice, you're going to have patients that have some chronic diseases that you have to manage as their oral physician or as their dentist, that you
Exactly.
have to do some consultations with as well. So that hospital environment is almost like a snapshot of reality when you're having those patients come into your private practice setting as well. So
Exactly.
so that's good. So
Exactly.
you mentioned some of the strengths of the program. What are some of the things that you all are doing as relates to an ongoing assessment? I know as part of the CODA accreditation, we have to have an ongoing assessment
Yes.
of our internal operations. What are some of the things that you guys are looking to improve within the program as well?
So one thing we do is we have two sites, and we've been looking at trying to figure out a way to cover a third one, and so in one of our sites, dentistry is really focused on. We have a beautiful clinic, great clinic, but at another one of our sites, we're looking for more space. So that's one thing. So right now, you will spend about, our residents spend about 65, I'll say 65% of their time at one site, and and the rest of their time at another site. Um, we 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 actually did get more OR time, but OR time in a hospital is, you may not really know it, but it's a really competitive type of a thing. Like, you really have to constantly show patient need
Yeah.
for OR time. But the OR is a really great experience.
Yeah, financial need too, because some of the procedures that we do as dentists does not, it pales to what other
Exactly.
specialists are doing to compete and get that OR time. And the hospital wants to, of course, maximize that OR time for those procedures that are more financially conducive. I mean, that's just what it is. Call a spade a spade. That's it.
Right.
The
Right, but
hospitals are a
there is a
business too.
great need, and we've been able in the past to show that need, because what ends up happening is there's a lot of patients who need treatment in the OR can't undergo treatment in the normal dental setting, even in a
Right.
normal hospital dentistry setting. And
Right.
so uh, there's a rehabilitation center in the county of Los Angeles.
Mhm.
And there's a dental clinic there, and there's a GPR program there as well. And what they sometimes will do is, because we're in a level one trauma center, they'll send some really sick patients to us, and we'll need to take them to the OR. But with the pandemic and the reduction in OR times, I think that was across the board. In order to manage the pandemic and really allocate resources to folks who were in, dire straits, we scaled back our OR time, and now we're starting to build it back up as we, develop so many more technologies to make people safe in this time of COVID. And so that's something that we're working on, that, but that's a constant thing. So so that goes back to us getting expanding our clinics. Right now we see thousands of patients. And
What's your annual patient population as far as number of visits?
so what I have for the county is well, for us, I would say roughly like 12,000, 13,000, something like that. And don't quote me on that because I don't have the actual number, but I will say that we have enough patients for you to see for our clinics to be up to upwards of 16 to 20 patients a day. We have enough numbers of that, and we have waiting lists. And so when it comes to capacity, our numbers they fluctuated, and don't quote me on this because the pandemic kind of brought us down, and we're building back up.
Yeah.
So but to answer the questions, kind of the essence of it is you will be busy.
Yeah. Yeah.
uh, you will be very busy. We have, you know, we have lots of patients of record, and we have lots for you to do with you when you come. And part of those things are we have, lots of fixed price to do, lots of implants to do. We also run concurrently or side by side with oral surgery program. And
Good.
so,
Good.
we're constantly uh, doing the restorations for their implants. Our residents are jumping in on their implants. We have a periodontist, so we're doing implants with our periodontist and our we're all working hand in hand, and it's a very collaborative environment as well.
So you meant
That's another strength.
Yeah, so you mentioned, so that's a good strength that you have collaborative practices among all the different specialties within dentistry that are there, and also with oral surgery. One point of clarification: you said the program is part of a hospital that's a level one trauma center. Can you explain
Right.
that to so people know what that means?
So level one trauma centers. So the best way I think I can put it is that, we for what it will mean for you as a GPR resident is that you will be on call, and you will see a whole host of you'll get a lot of experiences on call. Our oral surgery residents are really, really great in helping out GPR residents kind of get used to how the call schedule works. We have a really, really busy emergency room, and our oral surgery residents are handling. And again, you'll be tagging along with them, especially, when you're on call with them as well, is, gunshot wounds, car accidents, jaw fractures, facial fractures. Uh, Sometimes you'll be, running alongside oral surgery and ENT. So when you're in a level one trauma center, I think the biggest takeaway for that is just being able to handle call.
Yeah.
You'll get a lot of experiences with that.
So those experiences that people have of being on call, is it such that the GPR residents take first call, or the oral surgery residents take first call with, and then the GPRs tag on? How does
So,
what's the typical call schedule like for a GPR
so the
resident?
call schedule is split up between tooth call and face call. And so tooth call is what GPR residents usually take. And that's, pain, swelling, things of that nature. But you also will have, maybe sometimes you'll be on call alongside of an oral surgery resident, and they may call you in, even if they may be dealing with one aspect, and they want you to deal with another aspect. And so there's a first call, second call thing. Usually when it's tooth call, GPR residents are first call. When it's face call, oral surgery residents are first call. And that's kind of how it's set up. But we've had residents, especially residents who are interested in other specialties after GPR, there's that opportunity for you to jump in on all of it. Like I had one resident that did call-in rounds with oral surgery almost every day. And of course, he applied to oral surgery after.
Yeah, smart,
And
smart.
so,
Yeah,
right. And so
right.
he got a lot of great experience in that. And so that's another thing as a GPR, we have a lot of specialties, a lot of specialists there. Because, let's be honest, I know they just want to be specialists. And
Yeah,
so I think it's always good for a GPR. It's always good for us to support a resident in whatever they want to pursue. So, we have GPR residents who want to be endodontists and oral surgeons and pediatric dentists, and we have in prosthodontists. And every year I've been here almost, we've had someone go into a specialty. So
that's
we
good. That's
had someone
good.
going to peds, we had someone going to endo, someone going to pros, and someone going to oral surgery. So every single year there's been at least one. And if they haven't done it the year right after or applied while they were in the program, they've done it maybe 2 years afterwards or
Right.
something like that.
So,
So
so it sounds like most of the completers of the program, there's a good percentage of them that are looking to specialize, and they go on to either applying and starting those residency programs as well, the specialty programs, in addition to just doing general dentistry as well. So that's good.
exactly.
What? Tell me a little bit about the rotations, if you have some, because it sounds like with a vast number of different specialists that are there, as far as perio or surgery, maxillofacial prosthodontics, that there's probably some type of possibly some type of rotation on how the residents are getting a comprehensive care in addition to getting some specialty care as well.
So the main road I break them down into major rotations and minor rotations. So our major rotations are emergency medicine, anesthesia, and oral surgery. You do 2 weeks in emergency medicine, 2 weeks in anesthesia, and 4 weeks in oral surgery. And then I have minor rotations. Now, minor rotations are a function of the relationship that we've built with other services in the hospital. So there's a minor rotation in pediatrics, where you will go with, to the pediatric service and work alongside your medical colleagues with in that service, and it gives their residents the opportunity to kind of understand how to approach the children who may come in with
Right.
oral problems, oral health problems, or dental pain. But we all and then it also gives the dental resident, the GPR resident, the opportunity to see how pediatrics manages children
Yep.
and some of the issues that children may present with. And we just want to foster that collaboration. We also have a minor rotation in family medicine, which it serves kind of the same function, except you're seeing older adults and things of that nature as well. We have one with hematology and oncology, and that was because we get a lot of risk assessments for cancer patients who are undergoing all kinds of different therapies that have dental implications. If you noticed, years ago it was called bisphosphonate, uh,
Yep.
radial osteonecrosis of the jaw. Now it's called MRONs, right? And so there's so many different medications, and some of the medications that have been even used to treat COVID may have implications when you talk about monoclonal antibodies and things of that nature. And so I started looking at papers on that. There's not a lot of research out there about that yet, but that's something I'm going to increasingly tell residents to look into. And then we're working on something with cardiology. We do a lot of risk. We work very, very closely with cardiology and cardiothoracic surgery. And so we're working on getting a minor rotation in cardiology and cardiothoracic surgery. Um,
Awesome. So it sounds like you guys got a lot of things, both on the major and the minor rotations, in addition to the comprehensive care
right.
aspect of it. What about didactic, as far as the curriculum is concerned? What would resident typical resident week look like as it relates to didactic time, and when do residents take those classes? Is it in the morning, at lunchtime, in the evening, and how does that interact with clinic time as well?
So the majority of your formal lectures are at UCLA School of Dentistry in the first month or two of the residency, and it kind of it's a lot in the first month, and it tapers down in the second month, and then the next. And that's the majority of your classes in the summer. There's another there we take a class in the fall and a class in the spring, and those are, I think, on Thursday mornings. And those are your formal UCLA School of Dentistry classes. The other classes that are lectures and presentations and literature reviews and treatment planning conferences and the whole host of different things that we do are usually on Tuesday afternoons, and that is usually, and also it's not just didactics in regard to the biomedical dental respect aspect, but also I've been bringing in bankers and financial advisors and folks who own private. Like I was just meeting with someone yesterday who owns a few private practices, I think in Texas, about giving a lecture to residents about private practice ownership. And another part of my background is in 2019 I completed an MBA at Anderson School of Management at UCLA, and that actually gave me a lot of insight, because I think the industry aspect of dentistry is changing and it's growing. And what dentistry looked like 20 years ago doesn't look like that now, and it won't look like that in 10 or 20 years. So I want to have a lot of different people on the business side of dentistry speak
Yes,
to residents as well.
yes. So key, because that's not what we're taught in dental school. We're not taught about the business of dentistry. We're taught about how to be a very glorified and highly specific technician,
Right. And
right?
so, and that, I think that it's really important that you understand that, the autonomy a lot of times that drives you in the dentistry when you decide you want to be a healthcare professional. Uh, it's important that you know what that really means,
Yep,
and
yep.
how you use dentistry to support patients, but also staff, your family, their families. There's a lot that goes into it, especially as dentistry is evolving with technology moving at the speed of light.
Yeah, yep, and also what's at the speed of light is the number of grads or future grads considering residency or considering their next step. Right, that happens immediately. D4 year, and that transition from D3 to D4 year. So the next question is based on that, and it's based on some tips and advice that you have for those. That are considering residencies, and maybe even those that have not considered residency for whatever reasons. My question is, do you
Yeah.
think that most grads should do a residency? If so, why? And any other tips and advice that you can give those that are applying?
I think, yes, grads should do a residency 100%. Even if you have a situation that is already set up for you and established for you, maybe your uncle, your mother, your father, your aunt, somebody has a practice that they're saying, hey, I'm going to hand this over to you. I think it's important for you to do a residency, because there are things that you learn in that hospital environment that you're not going to learn in private practice until it actually happens, right? And so you want to be prepared for those types of things, but you also there's a more global, zoomed out perspective that I have for that, and it's networking. You when you get into a residency, you're not only networking with co-residents from other parts of the country, likely, you're also networking with other doctors who are usually in the dental community of that region. So if you come to Southern California and you are at my residency or any of our sister residencies, then you are going to meet other dentists, either attending faculty members or residents or oral surgery residents, or you're going to meet, a pediatrics resident or a you're going to meet people from so many different walks of life. And I'm big, and it's a big business principle as well, to always build a network. You always want to network, and you want to network outside of your organization. You want to network outside of your industry, and well, you want to network outside of your segment of your industry, because dentistry is not the entirety of the healthcare industry, right? So dentistry is a component, it's a segment of the healthcare industry. And I think it's really important that, as dentists, we begin or we continue or grow in our networking with our medical colleagues, our nursing colleagues, our, all the different folks who contribute to the healthcare system that we have. And so I think that's why that's one of the main reasons I think a residency is really important.
Plus it's connected to overall health, right?
Exactly.
You can't
Exactly.
you can't you can't have you can't have infection or conditions or chronic conditions in your mouth and still be healthy. Nah,
Exactly.
that's not how that works. So,
And you're right. You're 100% right. You're 100% right.
yeah, and oral health matters with regards to overall health. It's part of overall health as well. So,
Exactly. I mean, and there's
that's
times where when I was in private practice and I just had something that was on my head, I just called a physician that I knew, and that's a part of the networking. And because I had done a GPR, I understood how to describe describe my question to my physician colleague in terms that they would understand, because I've done it so much in my residency
yep,
program.
yep. There you go. Any other tips or advice for those that are applying to residency programs, or maybe even applying to your program?
Well, I think there's something to be said uh, about grit. And I think that, especially in these times where it's so dynamic, so many things have changed. You look at just the pandemic in itself and how many times we've had to evolve, not just as a healthcare community, but as the science community and as a society, uh, throughout this pandemic and all the other things that happened while, during it. I mean, the the social justice movements, uh, the political occurrences. We've all had to be able to adjust and stay focused to a lot of different things that may have been happening in the healthcare system, but also in our personal lives, in the lives of our friends and family members. We've all had to adjust to that, but healthcare workers have had to not just adjust to everything that's going on, but also stay focused on, okay, the science, the healthcare, the helping people. That has been, we are the, if anything has been shown, healthcare, that our healthcare system and our healthcare workers are the backbone of our society, because nothing moves when people get sick. And we are the folks in our society that are trained to to do that, and I mean to heal people.
Yeah, we're the
And
caretakers.
exactly. And so grit, I think, is really, really important. And I think that we look for grit in a lot of our colleagues in the medical field look for grit, and we look for not just diversity of identification, but we look for diversity of experience, and we look for even diversity of perspective, right? So you may not think you have this, that, or the other, but it's about, sometimes it is as fundamental as perspective.
Yeah.
And so, folks who can think outside the box will be able and be resilient in that, can treat someone who they may not understand their language. They may not understand the language the person is speaking, right? We have a good amount of Filipino patients and Korean patients, and so I name Black and Latinx, but we have a great diversity of patients.
It's LA. It's LA.
Exactly. So you need to be able to, even if you have to Google, on the fly, like, okay, let me get some background into what may be the cause of this oral health condition that this person may be having.
Yeah.
So grit and resilience are really important.
So you guys heard it here. If you're applying to this program, Dr. Grier, program director, just told you what they're looking for in candidates, what they're looking for as far as residents coming to and coming to be future trainees of the program and the completers of the program. Grit, diversity, right? And the willingness to adjust, but also refocus and contribute. So there you go. Dr. Grier, what's the best way for people to contact you if they have further questions, or either about the program or questions for you?
So you can go to our website. You just Google Harbor-UCLA Medical Center GPR, and you'll see my face. There should be contact information on there. If it's not, you can email me at rgrier2. That's RGRIER, the number 2, at dhs.lacounty.gov.
lacounty.gov. All right, there it is. You guys heard it. It's also down below the description. Dr. Grier's contact information and the website as well. Dr. Grier, hey man, thank you so much. This has been great. I'm glad we've been able to kind of spotlight and talk a little bit more about your program out in LA. I know there's a lot of people that from the East Coast that maybe will look at this as a one in a lifetime opportunity to go out to California to train for a year or two, or however long they want to stay out there. But having this information is very helpful. Because you're right, there is a vacuum of knowledge that you don't necessarily know all the specific details about a program that you can't find on the website. So being able to kind of chat with you a little bit more and find out more about your program and how the curriculum is and how the rotations are and the strengths and the improvements that you guys are working on is very, very helpful for a lot of people who are pursuing residency. Plus, in California, that's a licensure pathway too, right?
Yes. So it's licensure by residency in California. You need it. Well, I think in New York you have to have the residency.
New York, you do. Yes.
Here is one of the paths. So you come here and you can the licensure here will work for New York if you want to go back to the cold and you don't like this heat, and you don't like this Mediterranean weather. If you want to go back to those seasons, feel free.
Yeah, and you see where Dr. Grier is at. He's sitting at his beachfront home with his feet all in the sand, seat all in the sand, chilling. So, something to be said for that lifestyle as well. Also, guys, check out these next set of videos right here. Hopefully, these will help you out as well. And that's our time. Dr. Grier, Harbor-UCLA, thank you so much. And that's our time. Love, peace, and smiles. We'll see you on the next video.